Good day, everyone. This is Dr. Matson. We are going to cover alcohol in this presentation. And so we'll look at how it's made. We'll look at maybe a little bit of the history and how it works its way through the body. All right, so let's take a little bit of time to talk about fermentation products. So this forms the basis for all alcoholic beverages. Certain yeasts act on sugar in the presence of water, and then this chemical reaction is fermentation. Yeast recombines the carbon, hydrogen, and oxygen of sugar into ethyl alcohol and carbon dioxide. So, distilled products, distillation is a process in which the solution containing alcohol is heated, and then the vapors are collected, condensed into a liquid form again. There's still a lot of debate over who discovered the distillation process and when this discovery was made, but many authorities place it in Arabia around AD 800. In Europe, only fermented beverages were used until the 10th century when the Italians first distilled wine, thereby introducing spirits to the Western world. In the United States, the alcoholic content of distilled beverages is indicated by the term proof. The percentage of alcohol by volume is one half of the proof number. For instance, 90 proof whiskey is 45% alcohol. Typical distilled beverages sold commercially, such as whiskey or vodka, gin, these range between 40% and 50% alcohol content, which would be 80 to 100 proof. So, beer is made by adding barley malt to other cereal grains such as ground corn or rice. The enzymes in the malt change the starches in these grains into sugar, and then solids are filtered out before the yeast is added to mash to start the fermentation. Hops are added with yeast to give beer its distinct pungent flavor. Because most American beer is sold in bottles or cans, the yeast must be removed to prevent it from spoiling after packaging. So this is usually accomplished by heating it or pasteurization, they call it, but some brewers use microfilters to remove the yeast while keeping the beer cold. The carbonation is added at the time of packaging. Standard brands of commercial American beer contain about 4% alcohol. Light beers have about 10% less alcohol and 25 to 30% fewer calories. The mash is fermented at a cooler temperature for a longer time, so this way more of the sugars are converted to alcohol. Then the alcohol content is adjusted by adding water, resulting in a beverage with considerably less remaining sugar and only a bit less alcohol. The American brewing business has become even more consolidated and less American in recent years. The large Milwaukee based Miller Brewing Company had already been bought by the London corporation SAB. And Coors had merged with the Canadian brewer Molson before the 2007 merger that formed Miller Coors, with joint headquarters in Denver and London. So now two American brewers, each a wholly owned subsidiary of an international corporation, account for 60% of all the beer sold in the United States. So wine is one of the humankind's oldest beverages, a drink that for generations has been praised as a gift from heaven and condemned as a work of the devil. Although a large volume of wine is now produced in mechanized, sterilized wine factories, many small wineries operate alongside the industry giants, and the tradition continues that careful selection and cultivation of grapevines, good weather, precise timing of the harvest, and careful monitoring of the fermentation and aging can result in wines noticeably higher quality. This is a bewildering array of different types of wines. Most of the common distinction is between red and white. The red color in wines comes from the skin of red grapes. White wines can be made from white grapes or from red grapes if the skins are removed before fermentation. Wines are often named for the type of grape used to make them or for one of the traditional European land areas that are known for producing a particular kind of wine. Besides red versus white, another general distinction is dry versus sweet. The sweeter wines are likely to have a heavier taste overall, with the sweetness balancing out flavors that might be considered harsh in a dry wine. Because carbon dioxide is produced during fermentation, it is possible to produce naturally carbonated sparkling wines by adding a small amount of sugar as the wine is bottled, and then keeping the bottle tightly corked. French champagnes are made in this way, as are the more expensive American champagnes, which might be labeled naturally fermented in the bottle. This is a cheaper method that's used on inexpensive sparkling wines. Carbon dioxide gas is injected into a generic wine during bottling. Most wines contain about 12% alcohol. It was discovered many years ago in Spain that if enough brandy is added to a newly fermented wine, the fermentation will stop and the wine will not spoil or turn to vinegar. Other fortified wines, all of which have an alcohol content near 20%, include port, uh, Madeira, and Muscatel wines. So, our distilled spirits, today's standard product from many commercial distilleries is 95% per pure ethyl alcohol or ethanol, 190 proof. Into the process goes whatever grain is available at a cheap price and tank loads of corn syrup or other sources of sugars or starches. Out the other end come grain neutral spirits, a clear liquid that is essentially tasteless except for the strong alcohol taste, which might be sold in small quantities as Everclear or for use in medicine or research. Here's a funny story real quick. So my son bowled all the while he was growing up, and so I went out to dinner with these ladies while the kids were at the hotel. We were, I think, on a state tournament, and so the parents, go out, and the kids stay at the hotel and swim and play and whatever they want to do. And so our kids happened to get in trouble that time on the trip. And one of the supervisors, like adult supervisors, went in and the kids had like food and like all over the carpet, like smashed goldfish or something like that. And here we are like drinking down the street, and happened to be drinking Everclear. Well, you can only like the bar was only allowed to, or restaurant was only allowed to serve like 2 drinks per person. Like that was it on the Everclear because it's so strong. So I, of course, had my two, and this other lady, didn't finish her second one, so I finished that. So we were kind of tipsy because, we weren't gone very long, maybe an hour and a half or so. And I don't handle alcohol very well. I don't drink very much. Uh, maybe one drink when I go out, maybe two at the most. But I helped finish her Everclear that night. And then when we get back to the hotel, we start getting all these, calls and texts and stuff on our phone about the kids. When we got back to the hotel, it's like we were in trouble, you know. And so that sobered us up super quick. And, we ended up having to separate the boys. And it was really one kid, not all three that were in the room or four that was in the room that was kind of causing problems. And so he actually ended up staying with his mom that night. And then the other boys still stayed together. But I will never forget that. Like Everclear, like the one time I decided to try it and drink it, and then, all of a sudden our kids are in trouble and we're really not in the right frame of mind to to deal with the drama that was happening at the hotel. It was kind of funny. So I just thought I'd share that story. We'll continue on the next slide. All right, so picking back up where we left off, more often, this is processed in bulk in various ways. For example, large quantities of ethanol are added to gasoline to produce a less polluting fuel, which also helps out the American farmer. One of the first beverages to be made from straight grain neutral spirits was gin. And I know this was mentioned on the last slide with gin and vodka, but by filtering the distillate through juniper berries and then just diluting it with water, a medicinal tasting drink was produced. Another major use for the bulk grain neutral spirits is the production of vodka. Many inexpensive vodkas are simply a mixture of grain neutral spirits and water adjusted to the desired proof. When alcohol is first formed, other related substances known as congeners are also formed. Grain neutral spirits contain relatively few congeners and none of the flavor of the grains used in the mash. Whiskey is usually distilled at a lower proof, not more than 160, and thus the distillate contains more congeners and some of the flavor of the grain that's used. And so liqueurs are similar in some ways to the fortified wines. Originally, the cordials were made from brandy mixed with flavorings derived from herbs, berries, or nuts. After dilution with sugar and water, the beverages are highly flavored, sweet, and usually about 20 to 25% alcohol. Modern American peppermint, peach, and other types of schnapps are made from the grain neutral spirits, which are diluted, sweetened, and flavored with artificial or natural flavors as well. And then you can see there's, different types of whiskey that they make using this grain as well. Lord. Okay. Moving on. So historians seem to agree that at the time of Americans' revolution against the English in the late 1700s, most Americans drank alcoholic beverages, and most people favored these beverages compared with drinking water, which was often contaminated. The per capita consumption of alcohol was apparently much greater than current levels, and little public concern was expressed even the early Puritan ministers, who were moralistic about all kinds of behavior, referred to alcoholic drink as the good creature of God. They denounced drunkenness as a sinful misuse of the good creature, but clearly placed the blame on the sinner, not the alcohol itself. And then a new view of alcohol as the cause of serious problems began to emerge in America soon after the Revolution. It is so pervasive that some people have a hard time understanding what is meant by the demonization of alcohol, meaning that they view alcohol as a demon or devil. The concept is important partly because alcohol was the first psychoactive substance to become demonized in American culture, leading the way for similar views of cocaine, heroin, and marijuana in this century. All right, so temperaments movement in America. The first writings indicating a negative view of alcohol itself are attributed to a prominent Philadelphia physician by the name of Benjamin Rush, one of the signers of the Declaration of Independence. As a physician, Rush had noticed a relationship between heavy drinking and jaundice, which is an indicator of liver disease, madness, or perhaps delirium tremens of withdrawal, um, or what they look at as Korsakoff's psychosis, and epilepsy, probably the seizures seen during withdrawal. However, Rush also concluded that hard liquor damaged the drinker's morality, leading to a variety of antisocial, immoral, and criminal behaviors. And for the first time, this condition was referred to as the disease caused by alcohol, and he recommended total abstinence from alcohol for those who were problem drinkers. Other physicians readily recognized these symptoms in their own patients, and physicians became the first leaders of the temperance movement. What Rush proposed, and most of the early followers supported, was that everyone should avoid distilled spirits entirely because they were considered to be toxic, and should consume beer and wine in temperate or moderate manners. In the early 1800s, it became fashionable for the middle classes to join the elite in this movement, and hundreds of thousands of American business people, farmers, lawyers, teachers, and their families took the pledge to avoid spirits and be temperate in their use of beer or wine. And then in the second half of the 19th century, things changed. Up to this time, there had been little consumption of commercial beer in the United States, and prohibition will follow next. So, looking at prohibition, as political power swung back and forth, states would pass and then sometimes later repeal laws that intended to restrict access to alcoholic beverages. The first state prohibition period began in 1851 when Maine passed its prohibition law. Between 1907 and 1919, 34 states enacted legislation enforcing statewide prohibition, whereas only 2 states repealed their prohibition laws. By 1917, 64% of the population lived in dry territory, and between 1908 and 1917, over 100,000 licensed bars were closed. But a state prohibition law did not mean that residents didn't drink. They did both legally and illegally. They drank illegally in the speakeasies and other private clubs. They drank legally from a variety of the many patent medicines that were freely available. The U.S. House of Representatives occurred in December, and 21 days later, on January 8th, 1918, Mississippi became the first state to ratify the 18th Amendment. As stated in the amendment, a year after the 36th state ratified it, national prohibition came into effect on January 16th, 1920. And it soon became clear that people were buying and selling alcohol illegally and that enforcement was not going to be easy. The majority of the population might have supported the idea of prohibition, but such a large minority insisted on continuing to drink that speakeasies, hip flasks, and bathtub gin became household words. Organized crime became both more organized and vastly more profitable as a result of the prohibition. This popular conception is that prohibition was a total failure, leading to its repeal. But that's not the case. Prohibition did reduce overall alcohol intake. Hospital admissions for alcohol dependence and deaths from alcohol declined sharply at the beginning of Prohibition. And so Prohibition is repealed. In 1926, the Association Against Prohibition was founded by a small group of America's wealthiest men, including the heads of many of the large corporations in America. Their primary concern seems to have been the income taxes that they were paying. The 18th Amendment was repealed by the 21st Amendment, proposed in Congress on February 20th of 1933 and ratified by 36 states by December 5th of that year. When national prohibition ended, America did not return to the pre-1920s level of alcohol consumption, and sales increased gradually until after World War II, at which point per capita consumption was approximately what it had been prior to the prohibition. So, regulation after 1933, there was a few states remained dry after the national prohibition. Most allowed at least beer sales. Over the years, the general trend was for a relaxation of laws, and states that did not allow sales of liquor became fewer until 1966, and the last dry state, Mississippi, became wet. The minimum age to purchase alcoholic beverages was set at 21 in all states except New York and Louisiana before 1970, when the national voting age was lowered to 18. During the 1970s, 30 states lowered the drinking age to 18 or 19. However, times have changed, pushed by concerns over young people dying in alcohol-related traffic accidents. And then in the 80s, Congress authorized the Transportation Department to withhold a portion of federal highway funds for any state that did not raise its minimum drinking age to 21. And in 1988, the final state raised its drinking age, making 21 the uniform drinking age across all the United States. Federal taxes on alcoholic beverages are a significant means of gathering money for the federal government. Although most of the federal revenue comes from individual income taxes, taxes on alcohol produce about 1% of the total collections by the IRS, $10 billion in 2019. The states also collect over $6 billion each year in excise taxes and license fees for alcoholic beverages. When all of these are added up, more than half the consumer's cost for an average bottle of distilled spirits and taxes. In 2017, as part of the Tax Cuts and Job Acts, alcohol taxes were reduced for small producers of all types of alcohol products, and these reductions were temporary, and they were scheduled to go back to the old rates at the end of 2020. And I'm not sure offhand how the pandemic might have altered that. So looking at, who drinks and why and some of these patterns and stuff that we see, uh, um, we look at cultural influences on drinking. So when we compare alcohol use in various cultures around the world, it allows us to look at ethnic and social factors that lead to different patterns of alcohol use. For example, both the Irish and the Russian cultures are associated with heavy drinking, especially of distilled spirits, and with high rates of intoxication and alcohol-related problems. By contrast, though, Mediterranean countries like Italy and Spain have been characterized by wine consumption. often in a family environment and associated with meals. The most recent estimates from WHO, the World Health Organization, indicate that total per capita alcohol consumption is highest in Russia and several of the neighboring countries that were former members of the Soviet Union. Most Western European countries drink about 80% as much compared to the leading countries like Canada and the US, which are at about 65% as much. The lowest consuming countries are those with predominantly Muslim populations. And so it's important to note that the culture of extreme drinking does not necessarily correlate well with overall alcohol consumption. So the French and the Italians may drink wine in moderation with their meals and in family settings, but they do manage to drink a lot of wine. When we look at the United States, um, there was changes rising through most of the 70s, and they peaked in 81. And although beer consumption has declined since 1981, the most obvious change was the decline in the consumption of spirits before 1995. The last 20 years have seen a dramatic decline in beer consumption with increased sales of wine and distilled spirits. And there's been a steady growth overall in consumption for that same time period, but the latest figures are still about 15% lower than the peak consumption year of 1981. All right, so uh, we look at overall consumption of combining beer, wine, and distilled spirits for each state based on sales. And so New Hampshire has the highest per capita sales along with the District of Columbia. The District of Columbia is also the leader in sales of wine, whereas New Hampshire and Nevada sell the most beer. The generally low consumption in the southern states, and there's generally higher consumption in the western states, with the exception of Utah, which has a large Mormon population. And so these differences in per capita sales reflect differences in the degree of urbanization as well as some regional cultural differences. So the gender differences, so it'll surprise no one that males are somewhat more likely to drink than alcohol than females. So as one looks at those who drink the most as opposed to those who drink only occasionally, one finds an increasing proportion of males among the heavier drinkers. College students, though, the college years have traditionally been associated with alcohol use, and in 2015, the proportion of drinkers were about 8% higher among 18 to 22-year-old college students than others of that age. Many campuses have banned the sale or advertising of alcohol. Most colleges and universities have adopted a variety of prevention programs to reduce the negative consequences of excessive alcohol use. And in 2019, about one-fourth of college students reported binge drinking as defined by 5 or more drinks at a sitting. This is down from about 40% in 2000. And even more impressive is the decrease from 30% down to 16% in those who reported driving after drinking. Some alcohol is absorbed through the stomach, but the small intestine is responsible for most absorption in an empty stomach. The overall rate of absorption depends primarily on the concentration of alcohol. Alcohol taken with or after a meal is absorbed more slowly because the food remains in the stomach for digestive action, and the protein in the food retains the alcohol with it in the stomach. Plain water, by decreasing the concentration, slows the absorption of alcohol, but carbonated liquids will speed it up. Looking at distribution, the relationship between blood alcohol concentration, or BAC, and alcohol intake is relatively simple and reasonably well understood. When taken into the body, alcohol is distributed throughout the body fluids, including the blood. However, alcohol does not distribute much into fatty tissues. So if you have somebody that's about 180 pounds, but they're lean, they're real thin, they're going to have a lower BAC than a 180-pound person that's, considered to be overweight or obese, for drinking the same amount of alcohol. So several beverages are equated to 0.5 ounce of absolute alcohol. So a 12-ounce can or bottle of beer at about 4% alcohol contains, we would do the math of 12 times 0.04, which equals 0.48 ounces of alcohol. The same amount is found in a glass containing about 4 ounces of wine at 12% alcohol and 1 ounce of 100 proof spirits or 1.25 ounces of 80 proof spirits. And so alcohol is removed by the liver at a constant rate of 0.25 to 0.30 ounce of ethanol per hour. So to be on the safe side, it's estimated that one can metabolize about 0.25 ounces per hour, and that, this is 1/2 of one's standard drinks. One beer, one shot, one glass of wine. Over the course of an evening, if one's rate of intake equals one's rate of metabolism, one will maintain a stable BAC. But if a person drinks faster than one drink every 2 hours, his or her BAC will climb. Compared with men, women absorb a greater proportion of the alcohol they drink, and some metabolism of alcohol actually occurs in the stomach where the enzyme alcohol is present. And because this stomach enzyme is more active on the average in men than in women, women might be more susceptible to the effects of alcohol. Once absorbed, alcohol remains in the bloodstream and other body fluids. It is metabolized, and more than 90% of this metabolism occurs in the liver. A small amount of alcohol, less than 2%, is normally excreted unchanged, some in the breath, some through the skin, some in the urine. The primary metabolic system is a simple one. The enzyme alcohol converts alcohol to acetaldehyde, and then acetaldehyde is converted fairly rapidly by the aldehyde to acetic acid. Exercise, coffee consumption, and so on have no effect on this enzyme. So the sobering up process is essentially a matter of waiting for this enzyme to do its job at its own speed. The liver responds to chronic intake of alcohol by increasing the activity of the metabolic enzymes. Alcohol is like any other general anesthetic. It depresses the central nervous system. That's why we consider alcohol to be a depressant. The exact mechanism for the CNS effects of alcohol is not clear. As with the barbiturates and the benzos, alcohol enhances the inhibitory effects of GABA and the GABA A receptor. At higher doses, alcohol also blocks the effects of the excitatory transmitter glutamate at some of its receptors, so this may enhance its overall inhibitory actions. Alcohol also produces a variety of effects on dopamine, serotonin, and acetylcholine neurons. Researchers have continued to explore the various actions with an eye to understanding not only the acute intoxicating effects of alcohol, but also the long-term changes that occur when the brain is exposed to alcohol on a chronic basis. At the lowest effect, blood levels, complex, abstract, and poorly learned behaviors are disrupted. As the alcohol dose increases, better learned and simpler behaviors are also affected. If the alcohol intake is quote unquote just right, most people experience euphoria, which is a happy feeling. Another factor contributing to the feeling of well-being is reduction in anxieties as a result of the disruption of normal critical thinking. These effects depend on the BAC, also called blood alcohol level or BAL. Before suggesting relationships between the BAC and behavioral change, two factors must be mentioned. One is that the rate at which the BAC rises is a factor in determining behavioral effects. The more rapid the increase, the greater behavioral effects. Second, a higher BAC is necessary to impair the performance of a chronic heavy drinker than to impair a moderate drinker's performance. So scientific studies of the behavioral effects of alcohol is made difficult by the importance of the placebo effects. Timeouts. One important component of alcohol use is that drinking serves as a social signal to the drinker and others, indicating a quote unquote time out from responsibilities, from work and seriousness. The idea is that the alcohol releases people from their inhibitions, largely because the inhibitions represent concerns about what might happen, whereas the intoxicated individual focuses on the immediate irritant or the person who needs help right now. So, driving under the influence, attention was focused in the early 1980s on the large number of traffic fatalities involving alcohol. And several studies have demonstrated that the danger of combining alcohol with automobiles is dose related. Alcohol related fatalities are a greater proportion of the fatalities occurring during dark hours than those occurring during daylight hours, and are a greater proportion of fatalities occurring on the weekend than those that occur during the week. And so by 2018, you see the percentage has declined to less than 30% from the peak of almost 60% back in 1982. It's important to remember that 70% of all fatally injured drivers are male, whether or not drinking is involved. That men are more likely to be involved in alcohol-related traffic fatalities reflects three important facts. Any given car is more likely to have a male than a female driver. Men might take more chances when driving, even when they're sober, and male drivers are more likely than female drivers to have been drinking. Individual problem drinkers cause more than their share of traffic accidents, but the majority of alcohol-related traffic accidents are caused by individuals who have not been identified as problem drinkers. So basically, anyone who drinks and drives is a potential threat. No psychoactive substance has been as closely linked to sexuality as alcohol. Movies depict that a romantic occasion is enhanced with wine or champagne, and the use of sexual attraction in beer ads on television is so common that we hardly even pay attention to it anymore. On one hand, though, many people of both sexes for many generations and across many cultures have viewed alcohol's ability to enhance sexual interest and pleasure as a great benefit, and many continue to do so. But on the other hand, the use of alcohol is linked with risky sexual behavior, excuse me, early sexual experience, unprotected sex, as well as increased likelihood of sexual assault. It is known that alcohol is a frequent presence in sexual assaults, and laboratory studies on college students have reported related findings. Many of the effects of alcohol on sexual behavior are consistent with the alcohol myopia theory, which we talked about previously. So looking at blackouts, alcohol-induced blackouts are periods during alcohol use in which the drinking individual appears to function normally, but then later, when the individual is sober, he or she cannot recall any events that occurred during that period. Most authorities include it as one of the danger signs suggesting excessive use of alcohol. There was a meta-analysis of 23 published reports from 9 countries that revealed apparent variation across countries. But overall, just about half of those who committed homicide were under the influence of alcohol at that time. As with homicide, studies of assault, spousal abuse, and child abuse reveal correlations with drinking. Heavier drinkers are more likely to engage in such behaviors. Self-reports by offenders indicate a high likelihood that they had been consuming alcohol before the violent act. In spite of widespread concern about drugs being slipped into someone's drink, by far the most significant date rape drug is always and has been always alcohol. Most studies show that alcohol is involved in about 1/3 of all suicides. Suicide attempts seem to have a different background than successful suicides, but alcohol abuse is second only to depression as the diagnosis in suicide attempters. The relationship between alcohol abuse and depression is a strong one and has been the subject of many studies. Uh, so one effect of alcohol on the CNS, central nervous system, is the dilation of the peripheral blood vessels. This increases heat loss from the body, but makes the drinker feel warm. One action of alcohol on the brain is to decrease the output of the ADH or vasopressin hormone that's responsible for retaining fluid in the body. It is this effect, rather than the actual fluid consumption, that increases the urine flow in response to alcohol. This diuretic effect can lower blood pressure in some individuals. Chronic abusers of alcohol can develop a variety of hormone related disorders, including testicular atrophy and impotence in men, and impaired reproductive functioning in women. So, alcohol toxicity or alcohol poisoning, many drug related deaths include alcohol in combination with some other substance. So, it's difficult to know exactly how many overdose deaths are primarily due to alcohol versus another drug to the specific combination. Two pieces of advice are worth mentioning. If a person drinks enough to pass out, do not simply leave him or her alone to sleep it off. The person should be placed on his or her side so that any vomit is likely to be aspirated, and someone who is sober needs to monitor the person's breathing until he or she can be aroused and begins to move. Number two, it is particularly dangerous to drink to the point of vomiting and then begin drinking again after vomiting. The vomiting reflex is triggered by rapidly rising BAC levels, usually above 0.12%, but the vomiting reflex is inhibited when the BAC rises above 0.20 or so, and then it is possible to continue drinking, which would reach lethal concentrations. All right, so hangovers. Uh, they're definitely not much fun, right? And they aren't very well understood either. So even moderate drinkers who only occasionally overindulge and are well acquainted with the symptoms like upset stomach, fatigue, headache, thirst, depression, anxiety. Some authorities believe that symptoms of a hangover are the symptoms of withdrawal from a short or long-term dependence on alcohol. Some hangover symptoms are probably reactions to the congeners. The congeners we mentioned earlier, they are natural products of the fermentation and the preparation process, some of which are quite toxic. The nausea and upset stomach typically experienced can be most likely attributed to the fact that alcohol is a gastric irritant. Consuming even moderate amounts causes local irritation of the mucosa lining the stomach. It has been suggested that the accumulation of the acetaldehyde, which is quite toxic even in small quantities, contributes to the nausea and the headache. The best way to avoid a hangover is still to drink in moderation, regardless of the beverage, and drink water while you are drinking. So, as a general rule, heavy alcohol use, either directly or indirectly, affects every organ system in the body. Because alcohol provides empty calories, many heavy drinkers do not eat well, and chronic malnutrition leads to tissue damage. Perhaps the biggest concern is the damage to the brain tissue that is seen in chronic alcohol abusers. It has been reported for years that the brains of decreased heavy drinkers demonstrate an obvious overall loss of brain tissue. The ventricles, or the internal spaces in the brain, are enlarged, and the fissures, the sulci, is the cortex in the cortex are widened. Another classical alcohol-related organic brain syndrome has two parts, which often go together, and it's referred to as the Wernicke-Korsakoff syndrome. Wernicke's disease is associated with a deficiency of vitamin B1 and sometimes can be corrected nutritionally. The symptoms include confusion, ataxia, which impaired coordination while walking, abnormal eye movements. Most patients with Wernicke's disease also exhibit the Korsakoff's psychosis, which is characterized by an inability to remember recent events or the inability to learn new information. Fatty acids are the usual fuel for the liver. And so when present, alcohol has higher priority and is used as fuel instead. As a result, fatty acids or lipids accumulate in the liver and are stored as small droplets in liver cells. This condition is known as the alcohol-related fatty liver, which for most drinkers is not a serious problem. If alcohol input ceases, the liver uses the stored fatty acids for energy. And sometimes the droplets increase in size until they rupture the cell membrane, causing death of the liver cells. Before the liver cells die, a fatty liver is completely reversible and usually of minor medical concern. Alcohol hepatitis is a serious disease and includes both inflammation and impairment of liver function. Usually this occurs in the liver cells that are dead and dying, but it is not known if an increasingly fatty liver leads to alcohol hepatitis. Cirrhosis is the liver disease everyone knows is highly related to high and prolonged levels of alcohol consumption. Usually it takes about 10 years of steady drinking of the equivalent of a pint or more of whiskey a day. In cirrhosis, liver cells are replaced by the fibrous tissue collagen, which changes the structure of the liver. Cirrhosis is not reversible, but stopping the intake of alcohol will slow its development and decrease the serious medical effects. And then I know it mentioned heart on the last slide, but another area of concern is the effect of alcohol on the heart and circulation, and heavy alcohol use is associated with increased mortality resulting from heart disease. Much of this is due to the damage to the heart muscle, but the risk of the more typical heart attack resulting from coronary artery disease also increases. Heavy drinkers are more likely to suffer from high blood pressure and strokes. An interesting twist to this story is that several studies have found a lower incidence of heart attacks in moderate drinkers than in abstainers. And for several years, this protective effect of moderate alcohol consumption and the possible mechanism for it have been discussed. Alcohol use is also associated with cancers of the mouth, tongue, pharynx, larynx, esophagus, stomach, liver, lung, pancreas, colon, and rectum. A particularly nasty interaction with cigarette smoking increases the incidence of cancers in the oral cavity, pharynx, and larynx. The immune deficits seen in chronic alcohol abusers are associated with at least some increase in the frequency of various infectious diseases, including tuberculosis, pneumonia, yellow fever, cholera, and hepatitis B. Alcohol use might be a factor in AIDS for several reasons, such as loss of behavioral inhibitions, probably increases the likelihood of engaging in unprotected sex. Alcohol could increase the risk of HIV infection in exposed individuals, and alcohol could suppress the immune system and therefore increase the chances of developing full-blown AIDS once an HIV infection is established. The unfortunate condition of infants born to alcohol-abusing mothers was noted in 1834 in a report to the British Parliament. They have a starved, shriveled, and imperfect look, is what was quoted. Until fairly recently, most scientists and physicians believed that any effects on the offspring of heavy alcohol users were the result of poor nutrition or poor prenatal care. And then the symptoms of fetal alcohol syndrome, or FAS, includes a collection of physical and behavioral abnormalities that seems to be caused by the presence of alcohol during the development of the fetus. There are three primary criteria for diagnosing FAS, at least one of which must be present. Growth retardation occurring before and or after birth, a pattern of abnormal features of the face and head, including small head circumference, small eyes, or evidence of abnormal formation of the midfacial area, including a flattened bridge and short length of the nose and flattening of the vertical groove between the nose and the mouth, which is the philtrum. Or evidence, the third one is evidence of CNS abnormality, including abnormal neonatal behavior, intellectual disability, or other evidence of abnormal neurobehavioral development. Many animal studies have been done in a variety of species, and they indicate that FAS is related to peak BAC and to duration of alcohol exposure, even when malnutrition is not an issue. It is estimated that the overall rate of FAS in the general U.S. population is about 2 per 1,000 live births. If all alcohol-related birth defects, referred to as fetal alcohol spectrum disorder or FASD, are counted, the rate among heavy drinking women is higher, from 80 to a few hundred per thousand. So withdrawal syndrome, the abstinence syndrome that develops is medically more severe and more likely to cause death than is withdrawing from opioid drugs. For that reason, it has been long recommended that the initial period of detoxification, which is allowing the body to rid itself of the alcohol, be carried out in an inpatient medical setting, especially for people who have been drinking very heavily or have other medical complications. Looking at the stages uh, of withdrawal, we look at the progression of withdrawal from the abstinence syndrome, and it's described in these 4 stages. So stage 1, tremors, excessively rapid heartbeat, hypertension, heavy sweating, loss of appetite, and insomnia. Stage 2 would be hallucinations, auditory, visual, tactile, or a combination of these, and rarely olfactory signs. Stage 3 is delusions, disorientation, delirium, sometimes intermittent, and usually followed by amnesia. And stage 4 would be seizure activity. Medical treatment is usually sought in stage 1 or 2, and rapid intervention with a sedative drug such as diazepam will prevent stage 3 or 4 from occurring. The old term delirium tremens is used to refer to severe cases, including at least stage 3, and then tremors are one of the most common physical changes associated with alcohol withdrawal and can persist for a long period of time after alcohol intake has stopped. Wrapping up our final slide here is alcohol use disorder. And this is probably the most significant influence on American attitudes about alcoholism was a 75-year-old book called Alcoholics Anonymous. This book described the experiences of a small group of people who formed a society whose only requirement for membership is a desire to stop drinking. The disease model of alcohol dependence has received support from many medical practitioners and has been endorsed by the American Medical Association and other professional groups. When we look at treating alcohol use disorder, the U.S. Substance Abuse and Mental Health Services Administration recognizes 3 primary behavioral approaches to treating alcohol use disorder, in addition to those programs that rely primarily on the 12-step approach. We have motivational enhancement, which is also known as motivational interviewing. It's based on helping people to accept the need for change and then develop strategies for implementing and maintaining their efforts to change their own behavior. And then we have cognitive behavioral therapy, which focuses on stopping and preventing negative thought patterns and learning to behave differently in the situations that have typically led to excessive drinking. And then we have the contingency management. And the contingency management provides incentives when participants meet certain goals, such as remaining abstinent for a week. The medications that have received FDA approval for treating alcohol use disorder is Antabuse. This is the oldest of the medical treatments, and it acts by interfering with the metabolism of the acetaldehyde. Naltrexone is an opioid antagonist that blocks the effects of drugs like heroin, but has also been demonstrated to reduce cravings for alcohol. And then we have acamprostate, which reduces symptoms of protracted withdrawal and has been shown to help individuals with alcohol use disorder who have achieved abstinence and then go on to maintain abstinence for several weeks to months. There's a lot of scientific critics of the disease concept. So if alcohol dependence is a disease, what's its cause? How are alcohol abusers different from others? Except they tend to drink a lot and have many alcohol-related problems. And so the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, Lists 11 possible criteria for alcohol use disorder, including drinking more than intended, desire to cut down or stop, craving, drinking causing disruption of major life roles, social problems, giving up other activities, repeated hazardous use, tolerance, and withdrawal. The severity of the disorder is then ranked based on the number of these criteria, with 6 or more of the symptoms indicating a severe alcohol use disorder. And that wraps up our discussion tonight on alcohol. So I hope you learned a lot and stay tuned for more PowerPoints from me.